It's a little bit after 10. We can get started. Good morning, everyone. I am Anna Destry, Brown County's Public Health Officer. Thank you for joining us today for this update on COVID-19 in Brown County. For today's briefing, we will be joined by Brown County Executive Troy Struckenbeck, Prevea President and CEO Dr. Ashok Rai, and Bellin Health President and CEO Chris Valesky. As you have certainly heard, the number of COVID-19 cases is rising in Brown County. Our current numbers: 7,992 positive cases. That is an increase in 178. We have 61 deaths. That is an increase of 2. And we have 6,305 who are currently out of isolation. That is an increase in 93. We are alarmed by the rising number of cases. Although it was somewhat expected coming on the heels of a holiday weekend and with schools and colleges reopening, we saw similar spikes following other holidays this year. Having said that, it is still very concerning. By now, many of us, if not most of us, know someone who has had COVID-19. Some are not seriously impacted and recover quickly. However, some have long-lasting effects, and tragically, many have died. We know among some in the public that there is skepticism, but you can no longer ignore the numbers. And we need people to recommit to doing the right thing to stop the spread. Our hospitals are seeing and feeling the increase. That is why we've invited Bellin Health President and CEO Chris Valesky and Prevea President and CEO Dr. Ashok Rai to join us today. Let's start with Dr. Rai, who will talk about the current state at our healthcare facilities.
Sorry. Thank you, Anna, and good morning, everyone. Hopefully you can hear me now. Just to kind of give you, I know Anna covered some data, but as we look at the state of Wisconsin, our percent positivity rate, so the number of tests that are turning out positive versus total number of tests taken in the last 24 hours was 18% rate, 7-day average of 17%. We also have seen, per the state dashboards, an increasing rate of people coming into emergency departments with respiratory-like symptoms that could be consistent with COVID-19. Our local 14-day trend is also up. What we do between Bellin, Aurora, and Prevea from our testing sites is aggregate our data and submit it to each other so we can track that. And our 14-day percent positivity has been trending alarmingly up, and in this week, getting to the 20% level. And what this tells us is, although that our testing totals numbers are also up, the virus is outpacing our capacity to test here locally, and we need to do more. Our hospitals are also in a stressed situation with 71 in-house patients as an aggregate between our 4 local hospitals here in Brown County. Just to give you a perspective, when we worked through our first outbreak in the late spring, 47 would have been our record at that point. This number has been increasing throughout since last weekend and has sharply increased over the last couple of days. Although the hospitals are experiencing higher volumes and approaching a high capacity rate, all have the capability to continue to take care of the needs of the community. But that capability can change very quickly if our percent positivity rate continues to climb and the number of admissions continue to climb as well. As far as personal protective equipment, everybody has adequate levels of personal protective equipment, but with 70 patients in-house countywide and that number increasing, the rate of burn through that personal protective equipment goes up significantly, and this could be an issue in the coming weeks to months. Especially in the face of an upcoming flu season, we are extremely concerned about hospital capacities to take care of all of our sick patients. It's important to remember that not only COVID patients are in our hospital, but those that are suffering from heart attacks or strokes or other medical illnesses or those that need surgical intervention for their illness. And we need to be able to keep that capacity going forward as well. With that being said, and knowing where our hospitals and our local communities' health numbers stand, I turn it over to my colleague, the President and CEO of Bellin Health, Chris Waleski.
Thank you, Dr. Rye. As you just heard, the numbers in Brown County and in Wisconsin are rising, and it's cause, obviously, for great concern. I'd like to share our experience at Bellin in particular. Right now, 3/4 of our intensive care unit beds are filled with COVID patients, and 2/3 of our medical unit beds are occupied by COVID patients. These numbers are roughly double what they were approximately 2 weeks ago, and this is the highest volume of COVID inpatients that we have seen since we started with this pandemic. Our emergency department has experienced unprecedented surges of patients last Friday and more recently this week, when the need was so great that we had to hold patients on gurneys in the hallways to provide the necessary care to them. Additionally, 150 approximately of our employees are out on quarantine, mostly due to exposures in the community. This is serious. It's putting stress on the healthcare systems, and everyone needs to take it seriously if we are going to be able to reverse these trends. We have seen more young people infected, a trend obviously that's nationwide, and we're hearing about it on the national news, but especially it hits home here in Wisconsin. Just yesterday, the New York Times reported that 6 Wisconsin metropolitan areas were identified among the top 20 nationwide with the most cases on average over the past 2 weeks. Green Bay was 6th on that list, followed by Appleton in 7th. The others included La Crosse, which topped the list. The Oshkosh-Neenah area was 10th, Platteville was 12th, and Stevens Point 14th. This is a list that we do not want to be on and can easily be avoided by each of us taking personal responsibility for our actions. In healthcare, we're concerned not just with the most recent increase in cases, but we're also concerned about what's to come. With many of the recent cases being among the young people, we know that there is a very real possibility that this will now spread to parents and grandparents who are much more vulnerable to the impacts of COVID-19, much more likely to become very sick, and much more likely to need hospitalization and ICU, intensive care unit care. We cannot let that happen. All of us in healthcare know this pandemic has become tiring. We're tired of it too. We all want to go back to how it was, but the reality is we can't do that just yet. We are in the final push to get through this pandemic, another 3 to 6 months, and we too are hopeful that there will be a vaccine approved and rolled out, or that there will be medication and innovations that help us better handle this pandemic. But until then, it's time that we get serious and we do what we need to do. We each have to take responsibility to ensure and keep others safe. It's not the time to throw in the towel and say, what the heck? I'm just going to live my life. Think of others. Think of your parents. Think of your grandparents. Think of those who have underlying health conditions. It cannot be stated enough. Wear a mask, socially distance, wash your hands often, and please avoid crowds, gatherings, and other types of social events for now. And to the young people in our county, you're not bulletproof. While your risks of serious illness from COVID may be lower, we do not yet know the long-term health effects that you may suffer because you've been infected with COVID-19. The immediate risk of you spreading it to others is very high, and depending upon who you spread it to, it could be fatal. Thank you again for taking the time with us today to hear what's happening in our community. And now I'll turn it back over to Anna Destry.
Thank you, Chris. To wrap things up today, I'd like to introduce Brown County Executive Troy Struckenbeck.
Thank you, Anna. As you repeatedly heard today, we are all concerned about the increase of COVID cases in our county and in our region and also in our state. I urge all Brown County residents to follow the guidelines of our health experts. If not for yourself, do it for others, for your family and your friends, and for the greater good. First and foremost, the health impact is undeniable. The impact on our local healthcare systems is undeniable. And the impact on our local economy, our local jobs, is undeniable. I was feeling cautiously optimistic in the past few months as things were starting up and opening up again, allowing people to go back to work. Unfortunately, what we're seeing right now is that increase. And what we don't want is to go backwards. And so, as you've heard, we all need to do our part as a community to really fight this COVID case. Wash your hands, social distance, avoid public gatherings of large numbers, and really just think about the personal responsibility to help one another to make it through this. Want to remind everyone that this is, we've seen schools getting back, and now we're starting to see schools close. I want to make sure that everyone takes their part and realizes that if we do our part, we can win this. Make sure to wear your masks when you're out in public, social distance, and wash your hands. Do it for the greater good, and let's make sure that we're listening to the advice of local health experts. And at this, I'm going to turn it back over to you, Anna. Thank you.
Thank you, County Executive Struckenbeck. As you've just heard, COVID-19 is on the rise in our county. We are urging everyone to take personal responsibility seriously. Next week, we will be unveiling a new tool that will provide information and data for local businesses, families, and schools to use when deciding whether they should be open or go out to any sort of gathering. We're also actively working with businesses, events, and gatherings to help voluntarily curb the spread of COVID-19. However, if public health is made aware that an entity is not following our recommendations and is putting the health of the public at risk, or if a large outbreak is seen, we will notify the public that people who are at those places need to be tested. We need to do this for each other and to avoid overwhelming our hospital systems. With that, let's go to the Q&A. We ask that you identify yourself by name and media outlet so we know who is asking the question. Thank you.
Hey guys, it's Nate Phelps from Spectrum News. This is for Chris or Ms. Waleski and Dr. Rye. At this point, is this illness still controllable in this community, or are we at a tipping point where that has changed?
I guess, I'd say what we've learned about COVID-19 is things can change in a day. As it stands today, like I mentioned, we can continue to take care of the patients that are in front of us and those that are coming in. But our capacity could fill up in 24 hours, as we've seen in areas like New York or Miami or Phoenix, where it can just happen very quickly. As it stands today, we are not in a position of where I'd say the virus is overwhelming us, but we definitely are on the verge if we can't change local behavior.
Yeah, I would just add, I agree with what Dr. Rye has said. We can reverse this trend. I absolutely believe that, because when we look back at what we've done in the past and the impact that has had in terms of people socially distancing, staying home, going out only as necessary, we did see a decrease in cases and we saw a decrease in hospitalization. And so I absolutely believe that we can see that happen again.
This is Haley B. Miller with the Press Gazette. This is for either probably Anna or Troy. You've mentioned that, you've been in conversations with businesses about making sure that they are following protocols and that kind of thing. During the Packers home opener last week, I just happened to drive around Lambeau and saw some pretty crowded bars and large groups of people. So, in addition to, talking to business owners, is the county in a position, is there anything more you can do in terms of enforcement or really, encouraging businesses not to hold events that produce these large gatherings?
I can take that one. In the event that an individual school or business would consistently ignore our guidance and education, and their particular situation does not improve, that there may be additional steps that we take. But our goal right now is to work with businesses to provide them the education, the recommendations, so that we can move in the right path. If they ignore that guidance and it still continues to move in the wrong direction, then we will be doing more to possibly take action on that business or organization.
This is Kia from Fox 11 News. I've got a question either for, Purveya and Bellin Health leads, or Anna for you as well. It really centers around schools. I know the move to actually name places that have outbreaks is new, but what about schools that may have a teacher or staff member that tests positive? How do you balance keeping people's medical status confidential with also mitigating spread, making sure that there's no contact with anyone should they test positive?
We'll let Anna answer that one.
Yeah, I think that's where we rely very heavily on the partnership between the parents, the schools, and public health. We really encourage that if a student is known to be positive, that they're communicating that to the school so that the proper decisions can be made. When we're not having that open dialogue, that's when we're going to have situations where a positive or a close contact to a positive is within the school. If there is a case and someone does not disclose that through our contact tracing efforts, we're not going to know to provide guidance to the school that there may be a case. So it's really up to parents, schools, to keep having that open dialogue to make sure that everyone is aware of the situation in their school.
But even if parents, students, and staff members, do their part in communicating to the schools that they've tested positive, what should the schools be releasing to the parents and the students and other staff members?
So the schools can do different things. I've seen some do a dashboard. I've seen others send out a letter. There are various ways a school can communicate to parents that they had a case in the school and that their children may be in a low-risk situation. So it depends on the school. It's a school policy decision.
Mackenzie from Channel 2 here. This question is for Anna. You mentioned that public health has been working with different gatherings and events to try to mitigate the spread of this virus, but also that you will step in if necessary if that's being continuously ignored. I guess I'm just curious, what is the balance there? Are you seeing more people voluntarily working with you? Have there been issues with having to step in and deal with maybe groups of people that aren't following guidelines?
In general, we do see that people want to work with us, which is great. So they may call us directly and ask about guidance and recommendations so that they can carry out an event safely. We've seen that. Another situation is somebody may call us and say, hey, we've heard about this situation. So then we reach out to them and provide guidance and recommendations to the owners or to whoever is carrying on that event. And another thing that's available to us or to the community, so Ted Shove, who is our environmental health manager, he is willing to go out to sites to do a survey of the space and to provide guidance and education on how an event could be done safely, how a business or organization could put mitigation steps or environmental controls in to reduce the risk of COVID-19 in those facilities.
And this is Kia again from Channel 11. I'm not sure if this question is for you, Anna, or for Mr. Struckenbeck. But when it comes to, businesses that you see or places that you see are repeatedly ignoring direction from health officials, is there any consequential actions? Will we see any citations for those who don't want to abide by the guidance and insight from the health department?
If someone were to continue to ignore our guidance and recommendations and the situation worsens, there are steps or measures that we can pursue, such as a citation or even possibly closure. So we have to make sure that we're doing our part, though, and that we are providing the education and recommendations to lead them to success. But if that continues to be ignored and it gets worse, then yes, we would move to take some sort of action.
And can I just elaborate a little bit? I mean, what exactly would that, citation look like? I mean, do you guys have any numbers for charges and what happens that leads up to a closure? I would assume that maybe there would be a citation first before full-on closure or any move to do such a thing.
So we really don't want to do that. Our goal is to encourage businesses to do the right thing. So our number one goal here is not to do citations with businesses or close down. So I just want to make that clear. But in our ordinance, it does talk about some citation, a range that we could utilize. Otherwise, we would be working within the court system to take the necessary steps that we would need to.
Rob Sussman from WTAQ following up on that a little bit. Is that something you've had to do at all?
Nope. In general, when we have been in contact with a facility, they have taken our guidance, they have put their mitigation steps in place, and we have not had to get to that point. One thing that often happens with facilities, it's not that their employees got it within the facility, but it was a worker tied to that facility. So it's not even that they're spread in the facility. So they're taking steps then, like making sure their employees stay out sick or they're carrying out their quarantine period. So oftentimes they are following and listening to the guidance. So we have not had to go that route yet.
It's Nate Phelps from Spectrum News again. Can someone or all of you kind of characterize what you've seen in terms of I'm going to use the word compliance from the general public in Brown County? Has the message gotten through? Do you have an idea of how many people are wearing masks and doing the things that you ask them to? Is it a high percentage, low percentage? What's kind of the general attitude that you guys have observed in the county in the last couple of months?
I can take that one. It's a mix. I think you see in certain organizations, certain businesses, that they take it very seriously. They have put policies in place that require masks. Where it's less slippery is at personal events. So events such as a wedding or a personal gathering outside the household or a family gathering where they're not wearing masks or social distancing. So the masking is very effective in places that it's being utilized, but then when going to a private event where they don't require or ask of others to wear masks, then we're not seeing compliance there.
I would agree with Anna is when we talk to our positives, whether they're ambulatory or inpatient, and try to find the source, the majority have been the type of gatherings that Anna has talked about. It's not children going to school suddenly having an outbreak. It's really what's happening outside of that. The social gatherings that they're in a private residence a garage party with 100 people or 50 people is really where we've been able to trace some of our sickest outbreaks to. So I would say that in some organizations are doing it great when we observe that, but it's when you're outside of that confined, legal organization into a private event where we start to see the lapse in judgment.
And I would just add the fact that Ted Shove has done, our environmental manager, has done a pretty good job with outreach to all the different business associations within the communities. I know that Ashwaubenon Business Association, along with the Alloway Business Association, had reached out to us to be able to communicate to their members what are some of the different plans that could be adopted to help their businesses open safely. I know that, in going about the community into different places of businesses, I have noticed, the signs outside, the different items available for, making sure that the place is sanitized in terms of whether or not you're using a shopping cart, the distances that they're recommending when you're waiting in the aisle. I would say for the vast majority of the businesses in this community, because in the end, if you think about the business, their livelihood is at stake. A lot of these businesses are struggling to be able to remain open, and I think it's in their best interest, and I think and this is what we're seeing, is that they are making every effort to do the right thing so that their businesses can remain open. And that's really, when you think about the bigger message here today, is that, for a number of months, we as a community were doing really well in terms of combating this COVID. It's just in the recent weeks that we've seen an alarming rate of increase in positive cases that, we really need to take a step back and reassess how we go about within our community and really think about, as we look at the hospitalization rates, we do not want to see that increase to the point where we were very concerned in the very beginning stages of this. But overall, Rob, I think businesses in general have done a really good job in terms of trying to make the environment when we shop or go out safe.
Well, this is Haley with the Press Gazette again. So, given that the trend here seems to be sort of people's personal behaviors and personal gatherings, what more can you say at this point? What other, are you doing any more sort of education in the community to get this across? Because it does seem like there are a lot of people who are just steadfast in their belief that they want to get back to normal.
I would just quickly state that not only is Brown County putting and has repetitively put out social media posts, we are buying ads on traditional media forms. The state of Wisconsin through WEDC has a pretty aggressive campaign called We Are All In. That is hitting, a lot of different airways, whether it's in the social media platforms or traditional media formats. I'm not a scientist in terms of, the message and whether or not it's translating. If people are getting tired of seeing the same messaging over and over, I think we've been saying the same message since the beginning of March. What we're trying to do today is just reinforce the importance of us taking those really personal responsibility measures, wearing a mask, washing hands, maintaining social distancing, to really try to curb this recent increase that we're seeing.
At Troy's point, I know there's a concept that people have talked about of just fatigue, COVID fatigue, pandemic fatigue. I think it's important to remind everybody as we've been able to see how this virus has evolved and it's transmitted and what it does to the human body. This virus is not fatiguing, and this is not a time for us to fatigue. And you're seeing some of that with our percent positivity and attitudes around the community, but that can change. And if the attitudes can change, then schools can do what they need to do in educating our students, and we can go forward with businesses as normal. But really, we do need people this is the last time that we need people to get tired about it.
Yeah, I would echo the COVID fatigue is a significant challenge right now. We know that people want to do stuff with their friends and their family members more now than ever, but it's just not the time to do it right now.
Doug Schneider from the Press Gazette and USA Today Network, Wisconsin. Question for Anna. Say somebody in a scenario that was mentioned on this call, Dr. Rye mentioned some large weekend parties. Haley spoke of observations to around Lambeau Field. A lot of those are on the weekends. What steps does the county take when something is reported? Does somebody go out and inspect? If so, how quickly? And also, it sounds like a lot of these things, the bigger events, are on weekends. How many health department employees are at work there, at work on weekends to respond to this stuff?
So we've taken a couple steps to address those concerns. We've worked with the Village of Ashwaubenon and others to talk about what the tailgating and what safe tailgating could look like, and asking others to make safe choices. So that has been an initiative that the environmental health team has been doing. If we hear about a specific complaint ahead of time, then we're trying to reach out to the person that, or the organization that's holding it. And at that time, we're providing the education and guidance to them. If we find about it after, there's not much that we can do at that time, except for to acknowledge and that they held the event.
And so just making sure I understand this, if you heard about something, a bar, a large party or something, while it was going on, would you respond to that?
If we're aware of it, we may respond to it. But right now, our key thing is the education and promotion, because we don't have the enforcement to back up anything that we would do. The enforcement ability to back up.
Hello, this is John from NBC 26. We are curious if weddings and personal gatherings are clearly a source for outbreaks. What are you recommending for Halloween trick-or-treaters or those involved in high school sports such as football?
Yep, we are going to be putting out guidance similar to the CDC and DHS guidance, and it may actually already be on our Stay Healthy BC website. Really, it's looking at how can we do things, more non-traditional things for Halloween. So, for example, doing a haunted house within your house, creating a haunted house within your house with your kids, or watching a movie, or doing other activities together that may be a little bit more non-traditional. Because we want to be able to still celebrate Halloween for those who want to, but how can it be done in a safe way?
And again, any thoughts on high school football?
High school football does have guidance. It's going to be our guidance over and over again. Can we socially distance? If we can't socially distance for a period of time, then we're engaging at a risk behavior. And then that school or policy should be, that school or that team should be making a policy decision of, okay, can we do this safely? Are we potentially putting people at risk if we cannot? And then they should make that policy decision if they should continue that sport or not. Okay, well, I want to thank everybody for joining us today. Thank you for your time, and that would be it. Thank you.
Will there be a recording of this delivered afterwards via email?
It's a good question. Nathaniel,
Yes.
it's been recorded?
Yep. It will be.
Okay.
It's been recorded and it'll be sent
I
out.
appreciate it. I missed
have.
the first couple minutes. Thank you.
All right. Thank you.